Good morning, everyone. Today's topic of discussion is bone formation, which is an important topic as considered in your university exams. It usually comes as a long essay and asks as a 10 marks question very often. So, usually in bone formation, there are two ways by which the bone can be formed. One is the intramembranous ossification, where the bone is formed directly from the mesenchymal component, and the other one is the intracartilaginous bone formation, which is also known as endochondral bone formation, where the cartilaginous model is formed first, which is then replaced by the bone, which is laid down by the osteoblasts. So, in today's class, we will be discussing more about the intramembranous ossification. The intramembranous ossification is directly formed, that is, direct formation of bone within the highly vascular sheets of condensed primitive mesenchyme. Flat bone, skull, and clavicles are few examples of bone formation through intramembranous process. It begins towards the end of second month, that is 8th to 10th week of intrauterine life, and the sequence of events which are taking place during the formation are: first, there is a formation of bony matrix, then there will be formation of woven bone, which is also known as immature bone, then there will be appositional or layering growth of the bone, which lead to the formation of compact bone, which is a type of mature bone. Then is the formation of osteon, which is the physiological unit, primary unit of, that is functional unit of bone. Now, the first is the formation of bone matrix within the fibrous membrane, where the bone has to develop in the loose mesenchyme. There are few areas where stellate reticulum-like cells, that is star-shaped cells with loose cytoplasmic processes, lie in the loose mesenchyme. They differentiate into osteoblasts and start secreting bony matrix, and they soon begin to calcify. Even after calcification begins, the osteocytes they obtain nutrition and oxygen by the process of diffusion. Now, once that is laid down and we have detected that few cells which are going to be osteoblast and those cells will be forming the bone, the formation of woven bone will start. Woven bone is nothing but an immature form of bone where you will have irregular spicules of bony matrix in the bony matrix. It gradually lengthens into long anastomosing structures which are known as trabeculae. They extend longitudinally and radially, that is in all the directions, and they form more such anastomosing areas. Such anastomosis causes more amount of breathable areas in the bone, which is why this type of bone is known as spongy bone. These trabeculae they also contain rich blood supply, which is termed woven bone or immature bone. In areas with rich blood supply, the cells become osteoblast and they lay down matrix, whereas where you do not get a good amount of blood supply, they form chondroblast, which lay down cartilage. And this we will see in detail in the cartilaginous model, which is formed, which is the another type of bone formation. Now, once the woven bone is formed, third step is the appositional or layering form of growth mechanism where the compact bone will form. So, new layers of bone, the matrix is deposited over pre-existing bone surfaces and they will keep on depositing. So, this layering and deposition of the bone of one layer over the another is termed as appositional growth. As the trabeculae increase in width, neighboring capillaries are incorporated in the bony matrix to provide nutrition to the osteocytes in the deeper layers. In some areas, the new bone which is deposited, where in some areas the bone is getting resolved. So this simultaneous process of deposition and resorption of bone over one surface and the other surface is known as remodeling of the bone that helps in maintaining the shape and size of the bone throughout the life. Now, continued appositional growth and remodeling of the bone both together will help the formation of compact bone from the remodeling of the cancellous bone. So, in the central areas of bone, the bone remains cancellous as the trabeculae do not increase in size. The vascular tissue in cancellous bone differentiates into red marrow, which is where the RBCs and other component of blood are formed. Last and foremost is the formation of osteon. That is, once the compound compact bone is formed, a calcareous bone is converted to compact bone with a number of narrow canals which are formed lined by osteogenic cells. These canals enclose blood vessels that were present in soft tissue spaces of cancellous network. The consecutive lamellae of bone become added to the bony wall, which is known as osteon or Harveysian system, which is the primary elementary unit of function of the bone. These osteons are called as primitive osteons as they are short compared to those in the long bones. And as and when the new bone formation starts, these maturing osteons they get more and more longer. So, a pictorial representation of what we have studied till now so far in the intramembranous bone formation is that the mesenchymal stem cells they will proliferate and they will become star-shaped cells with long cytoplasmic processes. They will be forming even longer cytoplasmic processes, and few of the cells out of them will become more plump and they will be known as osteoblasts, which are bone forming cells. So these osteoblasts will deposit osteoid, and then this osteoid will be then uh, calcified. After the calcification, the first form bone is an immature form of bone which is known as woven bone, and via the appositional growth of this woven bone, we will get compact bone. Once we get the compact bone, we will also get the red bone marrow from where the different uh, particles of the blood are formed and they are released into the bloodstream. Then after that, the primary unit that is the osteon is formed once the compact bone is formed. The primary osteons which are formed, they are very small and as and when they mature, they will become more longer. So, a small note on the difference between the trabecular bone or the immature bone and the mature bone is that there is intertwining collagen fibers, whereas here they will have orderly arrangement. The interfibular spaces will be more in the woven, whereas less in the mature. Staining, it will be stained blue because it is more of a primitive origin, and this will be more stained pink and bright because it is much mature in its nature. Rate of mineralization in woven is more and in the mature it is less because it is taking place in an orderly fashion. Whereas if we talk about the mineral density, obviously that will be low in the woven, whereas it will be very high in the mature or compact bone. The water content will be vice versa. Mineralization, that is, mineralization in woven bone takes place majorly through the matrix fascicles, and in the mature and compact bone, it is majorly mediated through the collagen formation. So this is all about the intramembranous bone formation. I hope this was something useful to you. So in the next class, we'll meet with the intercartilaginous model formation of bone, and this is how we finish the class. Thank you.